Have you ever really thought about why paramedics have to ask all those questions before they can even touch you? Or why you have to sign a form when you're saying, no, I don't want help? Well, the reason for that isn't something you'll find in a brand new medical textbook. Nope. The answer is buried in some of the darkest chapters of world history, and it's a story that completely changed medicine as we know it.
And that brings us to the big question, right? The one that's at the very core of all medical ethics. When you are at your most vulnerable, who really gets to call the shots about what happens to your body? Is it the person in the uniform? Or is it you?
Okay, picture this. An ambulance crew is on a scene. The patient is obviously sick, but they're completely coherent, they know what's going on, and they are refusing all treatment. Just a flat no. So what happens? That tense moment, that standoff, is a daily reality for first responders, and the reason they have to respect that no is rooted in a past that is truly horrifying.
To really understand why a patient's no has so much power today, we've got to go back in time. Back to an era when a patient's voice meant, well, pretty much nothing at all. This was the age of what was called paternalistic medicine.
So before the 1940s, the whole philosophy was simple. Doctor knows best. The provider was the absolute authority. Decisions were made for you, not with you. Your consent, it wasn't just assumed. A lot of the time it was seen as totally irrelevant. And this way of thinking, it created a world where some absolutely unthinkable things could be done in the name of research.
During World War II, this doctor knows best idea was twisted into something grotesque. In concentration camps, Nazi doctors performed just horrific experiments on prisoners, all without a shred of consent. And let's be crystal clear, these were not scientific studies. They were acts of pure torture, and they almost always ended in permanent disability or death.
After the war, the world had to look itself in the mirror and confront these crimes. At what became known as the Doctors' Trial in Nuremberg, a new global standard for medical ethics had to be built, literally from the ashes of these atrocities.
What's really remarkable is just how quickly all of this happened. The war ends in 1945, and within just 2 years, the world comes together to create a foundational document to make sure this kind of thing could never, ever happen again. And that trial's verdict gave us what we now know as the Nuremberg Code.
And this sentence, this right here, this is probably the single most important sentence in the history of medical ethics. It's the very first principle of the Nuremberg Code, and it changed everything. Absolutely essential. There is zero wiggle room in those words. It's a line in the sand.
But the code didn't stop there. It went on to define exactly what voluntary consent really means. It says you have to be legally able to say yes. You can't be forced or tricked into it, and, this is huge, you have to be given enough information to actually understand what you're agreeing to. This is the bedrock of every patient's rights today.
Okay, so how does a set of principles from a war crimes trial almost 80 years ago find its way into the back of an ambulance today? Well, it's actually a direct line from that courtroom right to the protocols that paramedics use on every single shift.
That first principle from the Nuremberg Code, voluntary consent, it translates directly into what paramedics now call expressed consent. So before a medic starts an IV, before they give you any medication, they have to make sure you're old enough, you're competent to make a decision, and you get the pros and cons. And man, this slide just lays out the shift perfectly. The old paternalistic way of doing things, forcing treatment for the patient's own good, is gone. Today, the idea of autonomy is king. A competent adult who understands the risks, even if that risk is death, has a legally protected right to say no thanks and sign that against medical advice form.
But the real world is messy. What happens when these clear principles run up against the complicated reality of a patient who is also in police custody? This is one of the toughest environments where these ethics get tested every single day.
And this is not some abstract theoretical debate. Paramedics need a clear playbook, and that's why fire departments have very specific written policies to handle these situations. What you're looking at here is a real policy, Policy 503 from the Euless Fire Department in Texas. It's a perfect example of how those big ethical ideas get boiled down into concrete steps for first responders.
The crucial thing here is that care and safety have to happen at the same time. The paramedic's fundamental duty to treat the patient is still there, but it's balanced with some really strict safety protocols. Things like removing potential weapons from their pockets, making sure the patient is in a secure area, and having a police escort in the ambulance. Those aren't suggestions. They are mandatory steps to protect everyone.
So when you just step back and look at the big picture, you can see this monumental shift that's taken place. The entire relationship between a patient and the person treating them has been completely redefined from the ground up.
This chart just captures the whole journey perfectly. We've gone from a provider who is an authoritarian expert to one who is a partner. We've gone from minimal communication, basically just giving orders, to a detailed explanation of risks and benefits. And most importantly, we've gone from refusals being ignored to refusals being a legally protected right. It's night and day.
And really, that's the key takeaway here. This is not just a history lesson. The legacy of Nuremberg is alive and well. It's in the patient's Bill of Rights you see on the wall in every hospital, and it's in the operating procedures that guide first responders on every single call they run, every single day.
So, the next time you see an ambulance, just remember the profound history that shaped every single decision that gets made inside it. And it leaves us with one final very difficult question. We know what our rights are, they're crystal clear. But in a real crisis, where do we draw that incredibly fine line between respecting someone's choice and our very human duty to step in and save a life?